Political force if we can organize ourselves, and I think we can. So now it is my great pleasure to introduce Santi Gomez, who is Director of Programs and Research for Gasol Foundation in Spain, as founded by the champion basketball player Pau Gasol, will tell us more about successful strategies to address childhood obesity in Spain. Thank you.
Thank you, Johanna, for the presentation, and thank you to World Obesity Federation for offering us this opportunity of presenting today. I am going to introduce the National Strategic Plan for the Reduction of Childhood Obesity in Spain that we had the pleasure to contribute as a strategic partner of the Spanish government. The main goal of this wide public policy is to reduce childhood and adolescent overweight and obesity in Spain by 25% during the next decade until 2030. I would like to highlight two key principles of this wide strategic plan. One is promote healthier, safer, and friendlier environment where children live and grow up, and reduce the social and gender gap in access to healthy lifestyles. It's a plan that during the development and the implementation currently are involving a total of 18 Spanish ministries, depending on their competencies for public administration. Also, during the development stage, and the government created 4 negotiation table, a part of the one formed by the Spanish ministry. Was created the scientific table, the social entities table, and also the economic table, where were represented federations and associations of enterprises. This is the logical model of the plan. Very briefly, it contemplates 7 different environments where children grow, and also consider an holistic approach, not only including healthy eating or physical activity, also including the importance of sleep and taking care of psychological well-being of children, and is a plan mainly addressed to change structurally the environments where children grow in Spain. It contains 200 measures in total, and also since its approval, it has a budget allocation and a priority inside the general state budget, and also has been created the governance mechanisms by royal decree. This means that was created an interministerial plan committee, also advisory council, and also is in coordination with sectoral conferences with the autonomous communities and also the municipalities in Spain. To date, under the national plan, a total of 11 strategies or plans were approved, and also important royal decrees, such as the one that regulate the school canteens in Spain, and that will be a reality from next spring in Spain. Also, I would like to highlight that through this national strategic plan, we were able also to activate the collaboration of the government of Spain with the WHO to join Spain inside the acceleration plan to stop obesity, where also count with the collaboration of World Obesity and UNICEF. Also, at the same time, this national plan are giving us more force to activate advocacy lines within the regional governments in Spain that have delegated the competencies regarding health and education, and are important parts of the public administration in Spain to have effective measures approved in our environment. Once I have presented the National Strategic Plan, also I would like to present the program's strategy of the Gasol Foundation. In Gasol Foundation, we are creating preventative programs and also evaluating them through cluster randomized community-controlled trials. The first one that we started to study was one family-based intervention implemented through social entities. The study protocol is already published and obviously also registered. And also the great results of this preventative program is making feasible the scalability nationally through the National Strategic Plan and through the funds that the government has received from the European Union, specifically from the European Social Fund, that this will make feasible to reach more than 200,000 children and adolescents in Spain with an investment of more than 100 million euros to reach the private communities in Spain with this intervention that has demonstrated positive results. And also we are starting a validation study of this strategy in the city of Los Angeles in the US. Also, we are studying other preventative models, one implemented in schools, other addressed to early childhood, and another one addressed to sports and leisure time entities. All of our strategy lands on municipalities. We give a lot of importance to the local level to be able to produce a systemic change. We are piloting a pioneer intervention implemented at local level, a whole of system approach that receive the knowledge that we are generating and we are implementing through these four different preventative programs. Also, inside this pilot, we are taking advantage of this European project to coordinate from prevention to treatment, including also the coordination with primary care centers here in Sant Boi de Llobregat, where we have our headquarters in Spain, and also including the hospital, and also adding to more additional levels, generating awareness at local level, and also influencing directly in the local public policies that the Sant Boi de Llobregat government are implementing. Also, to make this feasible, you know that we are influencing at national and regional level, and also we are coordinating all of our strategy with international organizations such as the World Obesity Federation, UNICEF, or the World Health Organization. Thank you so much for your attention, and I hope you are enjoying the webinar.